Hello everyone! Welcome back to MJ Pharma. Today, we are covering the drug of choice in common gynecological conditions. From PCOS to emergency contraception, these are the essential first-line treatments every medical professional should know. Let's begin! Drug of choice for hypotonic uterus. Oxytocin. Drug of choice for atrophic vaginitis. Topical estrogens. Drug of choice for cervical cancer. Cisplatin. Drug of choice for endometriosis cancer. Medroxyprogesterone acetate. Drug of choice for ovarian cancer. Cisplatin. Drug of choice for mood change and premenstrual tension. SSRIs like fluoxetine. Drug of choice for reducing vascularity in fibroid uterus before surgery. GnRH analogs. Drug of choice for dysfunctional uterine bleeding, DUB. Medroxyprogesterone. Drug of choice for long-term contraception. Levonorgestrel. Drug of choice for vulvovaginal candidiasis in pregnancy. 1% clotrimazole. This content is for educational awareness only. Always consult a qualified healthcare provider before using or advising any medication. Thanks for watching. If this helped, like, subscribe, and hit that bell icon to stay updated with MJ Pharma.